Hey everybody, Dr. Ross here. And recently in the clinic, Dr. Karen Apple and I started talking about the effect that perhaps lumbar spine curvature, which I've drawn here, kind of the lumbar spine and the pelvis. I'm not an artist, but we kind of get the idea. How much that curvature, that lordosis, or that lumbar posture can perhaps have an impact on patients' feeling of abdominal distension and or bloating, especially in patients who already have underlying perhaps food intolerances or allergies or issues. So a real quick search of the internet, looking up the literature that it's in PubMed and other scientific locations, we found that it indeed can have a significant impact. Now, the amount of curve is not the only reason for the patient's bloating or abdominal distension symptoms, but it can have a significant impact. So the mechanism behind that is with this curve of the spine, a normal curve, a healthy curve of your lumbar spine, the muscles on the front, basically the deep hip flexors, the psoas, the spinal stabilizers. Psoas coming down from the front of the spine, kind of the side of the thoracolumbar spine, goes all the way up into the thoracic spine, that attachment points of the psoas. Those muscles balanced out with the extensor muscles provide this balance of neutral spine in the lumbar spine. With increased curve or excessive lordosis, what that does is that creates a stretching mechanism on the front of the body. It can be caused by numerous things in the body, in the low back. Tight muscles are weak, weak muscles are tight. So a lot of times, if an individual has a weak low back compared to the muscles of their legs or their arms or other parts of their body, it doesn't have to be an absolute weakness, but a relative weakness, those muscles can be found to be more tight and guarded, and that can hold this spine in a bit of extension, and that extended, over-exaggerated curve. What the literature shows is that creates a stretching mechanism on the abdominal musculature that allows the internal organs to essentially protrude forward. And there's a lot of fancy terms and names for this when that occurs, but basically, when these muscles are stretched over a longer period of time, they actually can lose some structural integrity, they can lose their weakness. You can actually lose the neurologic feedback from actually feeling what is a healthy length of those muscles and what is an overstretched. This overstretched feeling of those muscles becomes almost the new norm feeling-wise. They found that also it can cause some issues in the internal organs because all of the tissue, the fascia, all the tissues on the front side of that lumbar spine are stretched, and a certain amount of what's called dyskinesia and altered sensation basically can occur. Over time, what that can also result in is then you have altered mechanics of the pelvis, the SI joints, where pelvis attaches to the sacrum, which attaches to the lumbar vertebrae going up here. Those muscles can also become dysfunctional and guarded. And then you have the hip flexors, the rectus femoris, like I said, those deep spinal stabilizers of the psoas can then cause jamming and altered mechanics of the SI joint and the hips, and further aggravating the entire situation, which can result in even more guarding of those lumbar, the QL, the paraspinals. The glutes actually can get lower cross syndrome is one of the terms that is used for dysfunction throughout that lumbopelvic spine musculature. It's an interesting phenomenon that the literature does discuss, that if you are able to retrain by balancing out that musculature, strengthening the low back muscular, strengthening the deeper spinal stabilizers on the front of the torso, you can actually rebalance that curve and return that healthy neutral spine through the lumbar curve, the lumbar spine, and that can actually have a positive effect on feeling less abdominal distension and less abdominal bloating. So I've put the literature, the references along the bottom here. Feel free to look them up. Again, if you have any questions on any of this, contact myself. I'll also tag Dr. Karen Apple. She's currently on maternity leave, but when she gets back, she can reach out to you and discuss. We've been talking about this quite a bit, and she can share her insights from the naturopathic standpoint also. All right? Hope you have a great day.